Hi, thank you for joining us today for the Lightning Talk. My name is Priti Lakhani. I graduated from the Chan School in 2013. Today, for the Lightning Talk, we have Dr. Swati Piramal. She's a Renaissance woman. She's a philanthropist, a physician, and an esteemed alumni of our beloved school. She loves poetry and has a strong interest in history. But here today for us, she's a scientist and a very respected public health leader. In India, where the coronavirus is devastating lives, with infection rates being over 6 million today, causing daily wage workers to struggle to meet their basic needs, Swati leveraged 3 I's: ingenuity, intelligence, and her ideals to lead a holistic effort. In doing this, she helped to avert a famine, provide access to clean drinking water, and prevent a plague of loneliness amongst the most vulnerable and socially isolated. Swati, please share with us how you did this.
Dean Michelle Williams, fellow alumni, ladies and gentlemen. I am going to speak about battling against COVID-19 on the ground and in India, and how values created value. I'd like to start with an ancient epic story. In a war between the Pandavas and the Kauravas, Lord Krishna gave his advice to Prince Arjun on managing the battlefield of life. The formula is this: jnana, knowledge, plus karma, action, and bhakti, compassion or care, is equal to dhriti, impact. And so using these values, we started to work during the COVID pandemic. First, jnana. Our scientists, using their knowledge, were able to start a clinical trial for a medicine that could reduce the deadly cytokine storm caused by COVID-19, that put patients in intensive care. What would have taken a year was completed in 3 months. Scientists collaborated globally with peers. Knowledge was moved faster than the speed of sound. Karma or action. To achieve scale, our foundation worked with state governments. The need was massive, and the challenge was to get impact for a large number of citizens quickly. Mobile vans, which were trained to help mothers and children, were retrained to help families struck by COVID. They went from village to village as there were no hospitals, and they provided medicines and medical help with doctors and nurses in the van. Every single village in the state of Andhra Pradesh, Assam, and many other states was covered by this service. The foundation moved teams to helplines, helping and answering questions on COVID. They completed nearly 1 million calls in 100 days. In Assam, one of the states the Public Service Partnership helped to triple the helplines to help with contact tracing. Sarvajal, our clean water service, activated a contactless water teller machine, almost like an automatic teller machine but serving water, to supply very, very clean water. Nearly 1.8 billion liters of water were purified in just 3 months. Public-private partnerships were at the center of all the efforts, action or karma. Teams acted virtually and quickly to turn ideas into action. Bhakti or compassion, an idea from our education arm, quickly evolved into adoption by Niti Aayog, the Planning Commission, and regional governments. It was a public health innovation to reach out what we call aspirational districts, the poorest and the most backward districts in India. There are no hospitals here, or even a single ventilator, no running water. People wash their hands in soil rather than soap. Here, the most vulnerable are the elderly. In these rural areas, the COVID infection came after the urban areas, but when it did, it was like a tidal wave. The death rate climbed as migrant workers returned from urban areas to their homes and villages. Here was that innovative idea. India is very well served in telecom lines. training nearly 100,000 volunteers in a matter of days and pairing that with government's data, we enable them to reach 200,000 house calls and more than 1.6 million phone calls to find elderly people in need. Young teenagers started to call the term, which we use for grandparents, Nani, Nana, or Dadi, Dada Protection Force. Each volunteer called 100 elderly citizens, gave information, helped get medicines, pensions, or food, connected with regional district governments where it was needed. No one had called the elderly before. They were left alone, frightened, fearful, and locked down. This simple idea was replicated in 115 aspirational districts where nearly 40 million people live. It was compassion, bhakti at scale. The young volunteers realized that service for others gives true happiness. Just thinking of your own fear is narrow, short-sighted. Human intelligence is wise. Human nature is compassionate. Positive emotions give inner strength. The power of teams and the power of ideas created a huge impact that was widely reported in the media and in television. The feelings expressed by the elderly on the ground were a profound relief and gratitude for the strong hands and the young voices reaching out to them. As the Dalai Lama said, without losing courage, sadness should transform determination. Don't feel helplessness. Make the effort. I'd like to talk about another story, which is very inspirational for me. Some 3,000 years ago, there was a young prince called Ram. His wife Sita had been kidnapped by the demon Ravan and taken to a remote island of Lanka. To find Sita, Ram traversed many forests and enlisted the help of a vast army of apes and bears that would help construct a massive bridge from India to Lanka. Huge boulders were pushed into the sea to construct the bridge. On the shore, a group of squirrels wanted to help Ram in his mighty quest. They scurried around, pelting small pebbles into the sea. The big apes made fun of this tiny little effort. Lord Ram heard this derisive laughter and said, "The little pebbles make the big boulders stable. So everyone can make a difference." Lord Ram stroked his finger on the back of the squirrel, and that's why to this day, the Indian palm squirrel has 3 stripes. Amidst the global pandemic, the world is facing an unprecedented health, moral, financial, and leadership crisis. We wondered what we could do, just a few people, to battle COVID-19. In India, the infections are breaching 6 million and growing rapidly. It was as if a storm of loss of lives and livelihoods was breaking across the nation. It brought fear and anxiety. The poet Iqbal said to the eagle, "O eagle, do not fear the oncoming storm. It comes to make you soar high above the winds." And that is what inspired us. One of the most severe lockdowns in India, more than 1 million people in Mumbai living in crowded slums face severe hunger. To combat starvation, getting cooked meals into the slums was a big challenge. Cooking in huge vats to get a simple, nourishing meal that we call khichdi, it's made of lentils and rice or kedigri, to millions of families. Leveraging public-private partnerships like the ISKCON, Anamrita Foundation, the Reliance Foundation, Rotary Foundation, Amit Chandra Foundation, we came together to serve nearly 20 million cooked meals. And if access was limited, we gave away food kits. A famine was averted meal by meal, just like the little pebbles the squirrels gathered and made a huge effort. Bill Gates, just in his interview 3-4 days ago, mentioned this, that philanthropists stepped up to minimize damage in India and really worked very hard to avert hunger and famine. Share this little video. summary, using our values, knowledge, action, and care, they are like a lighthouse which guided us in a crisis, leveraging the power of partnerships, many hands working together to achieve scale, and using innovation and technology to reach out to those who need it the most. I had spoken about how our values create value in our school forum some years ago. In the pandemic, values continue to create values. In the end of my squirrel story, Rama reached his beloved Sita, won a great battle against the 10-headed demon Ravan. Like Ram, we had many helpers and leveraged public-private partnerships. Like Ram, we hope to defeat our invisible, mighty enemy, the coronavirus, together using many hands. I'd like to thank all the men and women on the front line in the battle against COVID-19. I'd like to thank especially Harvard Chan teachers for teaching us the internal principles of public health. We, the students, use these many years after graduating to make a difference in the world. Thanks to the government of India, Niti Aayog, partner foundations, scientists and collaborators who joined hand in the battle against COVID-19. Thank you very much.
Wow, Swati, thank you. Bhakti plus Jnana plus karma equals Dhriti. What a great formula. What was the hardest part about all of this?
I think it was getting past your own, negative feelings. For example, there was complete confusion on what to do in this new disease. We were all severely locked down in small places with inability to reach out to help those who needed it. And so you felt that helplessness in the beginning. And then it was saying, no, we've got to act. We've got to do something. We cannot watch, the migrant workers going home hungry. A famine is something which is culturally very against the morals in India. We had the Bengal famine, you may remember, during Indian history. And famine was something that we didn't like at all. And then it was getting youthful people, young people, to partner us in this mighty quest. And I think that was the most satisfying. They just took it like a duck takes to water and really made a difference across the nation. They've said it's now not your campaign, it's ours, and we are going to work harder after the COVID pandemic.
Amazing, amazing results. Thank you so much for being with us today and sharing this incredible feat. And thank you, Swati ji.